She just drank water and now she's lying here.
Did you know that in 2009, the annual incidence of leptospirosis ranged from 1 to 10 cases per 100,000 people? But what is leptospirosis? Leptospirosis is an acute infection caused by Leptospira bacteria. It can be transmitted through contact with animal urine or contaminated water. The name Leptospira comes from the Greek words lepto, which means thin, and spira, meaning coil. So, Leptospira is a thin, spiral-shaped bacterium that causes leptospirosis. How is it spread? Animals that carry Leptospira, such as rodents and rats, contaminate lakes, rivers, and other bodies of water through their urine. In this animation, we can see a child playing in the river with an open wound, unaware that the water has already been contaminated by the rat urine. The bacteria then enter his body through the cut on his skin. 3 days later, he develops a high fever and muscle aches.
Leptospirosis is dangerous. So, what are the causes that can lead to leptospirosis? A bacteria called Leptospira is the main cause of this disease. Many animals, such as rats, carry this bacteria in their kidneys. Once it gets through an animal's body, it will travel through the blood to the organs, then come back in the kidneys. The kidney will read out the toxic matter in form of urine. This urine can contaminate soil and water. Now we need to know how does this bacteria gets into our body. There are actually multiple ways for this bacteria to get into our body, which are through mouth, eyes, and through breaks in our skin, like wounds and scratches. Drinking contaminated water, directly touching urine from animals that have leptospirosis, or getting contaminated water through parts that I have mentioned can cause leptospirosis. There are lots of people who get this disease after heavy rain and floods. This is because the flood water washes into river, lakes, and canals, bringing bacteria with it. To add, this disease is rarely contagious from one person to another. However, it can be transmitted through breastfeeding.
Symptoms of leptospirosis generally start around 10 days after exposure, but may start anywhere between 2 and 20 days after exposure. People with leptospirosis have a wide range of symptoms such as fever, chills, headache, muscle ache, red eyes, vomiting, diarrhea, abdominal pain, cough, sore throat. The illness generally lasts from a few days to 3 weeks, but may occasionally last longer. Next, between 5 and 15% of infected individuals may develop severe symptoms and need to go to hospital. In this group of people, the disease can be fatal. Severe symptoms include all of these.
Individuals that are prone to be infected with this disease are people with high-risk jobs, meaning jobs that are exposed to animals, waters, or soil that is contaminated with Leptospira bacteria. For example, farmers, veterinarians, miners, and military personnel. In addition, individuals who indulge in activities that involve direct contact with natural water source increase the risk of infections. For instance, campers, hikers, and water sport participants. Last but not least, people living in specific environmental conditions have higher risks due to frequent exposure to contaminated water and rodent activities. To illustrate, villages of flood-prone areas and areas of poor sanitation.
Is there any treatments for leptospirosis patients? Yes! Healthcare providers treat leptospirosis with antibiotics such as doxycycline, ampicillin, and penicillin, which are directly using intravenously drip. In severe cases, additional treatments may include renal replacement therapy, ventilatory support, and continuous monitoring to ensure proper recovery.
Okay, so first of all, we need to always wear our protective gear, such as boots and also gloves.
Always store drinking water in tightly sealed container and avoid leaving it with open container as it can easily be contaminated, especially by animals like rats.
We can also cover cuts and scratches with waterproof bandage to prevent the bacteria from entering the body through these potential entry points.
Other than that, to avoid getting leptospirosis, we also need to use soap frequently. Washing hands after having any contact with high-risk areas like open food storage that attract rodents, leaky pipes, tap areas where rodents can find water, and poorly sealed garbage bins can help prevent the bacteria from spreading to our bodies. Furthermore, always take shower with soap if you are exposed to flood water so that you can stay clean and hygienic.
Even though cats are not the primary carriers of leptospirosis, consuming contaminated water or infected rodents will cause them to get infected. So, to prevent leptospirosis, we can minimize direct contact with cats, especially stray cats. Don't allow them to lick you, and always wash your hands after grooming stray cats. Also, avoid exposure to cat urine without wearing gloves or protective gear. Lastly, provide clean cat food and water, then letting them drink from puddles or contaminated water sources.
Leptospirosis is a serious but preventable disease. By maintaining hygiene, avoiding contact with contaminated water, and taking necessary precautions, we can reduce the risk of infection. Early detection and treatment are crucial to prevent severe complications. Stay informed, stay safe, and spread awareness to protect yourself and your community.